decoding acid reflux through Ayurveda, how we can easily understand and how we can manage this disease through Ayurveda. So let me give some of the introductions related to this. In that, acid reflux, we call, or a patient comes to us and tells us it has something related to the gastritis. This is a common terminology what they use. But as in a medical profession, this acid reflux is understood in a very wider sense, and all the symptoms which are related to the esophagus, stomach, and even duodenum. These three structures will be involved in its pathology, and there are some anatomical changes will happen. There are some physiological changes will happen, and there are some environmental factors, or it may be a stress factors, occupational factors. All these club together, and it goes as a one clinical symptoms from the patient side. So how we can assess this and how we can easily treat these diseases, or how effectively we can manage with the medications or even diet and home remedies is a point of discussion today. When we come to a clinical presentation of a patient, what are the points we are going to assess, and how effectively we can treat these diseases depends on in what stage the patient comes to us. That is very important when we are dealing with such diseases, because blindly or in a broader sense, I cannot say that all the reflux esophagitis or reflux acid reflux diseases can be treated by Ayurveda. This is not be true always. There are certain conditions which can be treated effectively, and the one can get relief within 7 days or within 5 days or maximum within 2 weeks. So this is a strategy what we have to understand. And when a consultant sees such a client, and we'll be having 3 points in our mind. What are those points? Whether this condition can be cured, whether this condition can be managed with the diet, or whether this condition can be in need of some advanced treatments or not, or whether we need some help from the allopathy system of medicines. So like this, these questions will be coming. So all those points we put it together as a prognosis. Okay. So whenever one person comes to us, how we deal with that diseases, and how I decide with the clinical conditions, and what is my plan, and how effectively I can treat, and what are the benefits that person can get. So these strategies I need to follow. For that, once this point is clear, how what is the stage of the patient, then we can assess, or we should assess, what is the clinical presentations. And based on the clinical presentations, we have to interpret this whole disease in our language. We know that in Ayurveda, all the diseases are explained under three doshas. We call it as Vata, Pitta, and Kapha. And the diet modifications, the treatment methodologies, everything changes from persons to person. In total, we can call it as a customized medicines. For individually, we have to give separate advices, and also even the diet patterns. And once this point is also clear, then we need to break the pathology. How we can break the pathology? Once again, it's through the diet, or it is from the some of the remedies which we can get from our kitchen, or there is a need of a consultant. So these 3 steps we are going to follow. When we come to the overview of an ailment, what will be the first complaint told by the patients? So the first complaint will be something is coming, or it is like a regurgitation. We call it as there is a regurgitation of food contents from the stomach to the esophagus. This is a medical terminology. So whenever a patient burps, there is a small part of food is coming, and he feel the sense of food coming back into the esophagus. So this is normally present in all the individuals for about 20 minutes per day, but it may not. If it exceeds more than that, then we call it as a disease. Immediately after a heavy meal or something, if you are taking a liquid diet and all, there will be a small amount of regurgitation, no problem. So that is a normal one. But this occurs more than 20 minutes per day. So then we call it as a illness. So what will be the etiologies? So here we have to, I'm just giving you a hints regarding what are the terms a doctor says, or if you have already diagnosed with these diseases, what is the problem that will be written in your reports. So the etiological factors, like they'll be telling something related to hiatus hernia. There is a big word will be explained there. So this is something related to the anatomical changes that happens in the lower part of the esophagus. It means between the stomach and esophagus there is a gate which protects the contents of stomach from not allowing back, that is not to regurgitate back into the stomach. So this gate, when this gate is damaged, so that is the main issue in 90% of the cases. Due to long-term illness, or the patient is having improper dietary habits, there is a regurgitation oftenly happening in them, and over a time period this becomes an illness. So that we call it as lax LES, or it is the relaxed lower esophageal sphincters, and it happens most of the times because of the improper dietary habits. And in few cases, it may be related to congenital anomalies or something related to the muscular issues. All those will come. And here, let us concentrate only with the dietary issues. So once it happens, next is a advanced stage, that is a hiatus hernia will happen. So this is a small portion of stomach is coming to the coming towards the esophagus. This is the anatomical changes which is going to happen. Third one, when we study here, we'll be seeing this Helicobacter pylori is the one organism which is responsible for the onset of reflux esophagitis. This is most common in few European countries and also in certain parts of Asia and India. And nowadays the frequency has been diminished, but still there is a chances of infection of Helicobacter pylori. And once these three mechanisms happens, once there is a onset of all these changes happens in the stomach and in the lower end of the esophagus, then there is a clinical features. Here the patients will tell us a simple clinical features like pain. So we need to ask, where is the pain? What exactly its pattern? When it increases? When it decreases? We need to note down all these so that we are going to get an exact picture what is the problems related to that particular individual. Now, once the pain is asked, the immediate question you have to ask is related to site of the pain. Where is the pain? Then patient says it is just below the chest, near to the heart region, or they may say near to the stomach region, or towards left and towards the middle. These are the common terms they are going to tell. So with that, we have to decide whether it is related to the upper part of the esophagus, lower part of the esophagus, or it is related to the stomach. So this kind of approach we are able to identify with the symptoms told by the patient. Next is a dysphagia. The dysphagia means it is a difficulty in deglutition. So never think that this gastritis or acid reflux will be pertained to or restricted only to the esophagus and stomach. In few cases, the symptom starts from the throat. Because of this regurgitation, few can have pain in the stomach, pain in the throat region, or a kind of discomfort, ulcer formations and all. Even they are unable to drink the water or even swallow the food. This kind of things will happen. And third one is a hemorrhage. Hemorrhage means it's a bleeding, and few can say about the sputum mixed with the blood, or the saliva mixed with the blood, or even the frank vomiting which is mixed with the blood. So these are the most common clinical features we are going to get. And hemorrhage or bleeding will be common when there is a vomiting.